Very good afternoon, ladies and gentlemen. It's my pleasure to speak to you on the occasion of the 2023 European Kidney Forum. This year, the forum offers a valuable opportunity to discuss and debate on the important role of the European Union in facilitating patient-centered and sustainable innovation in kidney care in Europe. While nowadays we are all used to taking our smartphones and laptop computers everywhere we go, kidney patients still have to rely on large dialysis machines that cannot be moved. Dialysis is especially burdensome for patients, consuming time, effort and energy. It is often not patients' preferred choice, yet it is currently the only option for most. Unfortunately, the impact of dialysis does not stop at the patients. Dialysis places a heavy burden on the environment and is not ecologically sustainable. Each dialysis session requires hundreds of liters of water and produces an enormous amount of greenhouse gases and plastic waste, further contributing to Europe's large environmental impact. Moving forward, it is crucial to ensure a less burdensome, more sustainable and more patient-driven therapies, and the EU can be a global leader in this field. So let us make the only choice we have in front of us and together invest in green innovation indeed, green nephrology, to ease the burden of kidney disease. The European Union has a crucial role to play here and can contribute drastically to improve the lives of patients. As a co-chair of the member of the European Parliament Group for Kidney Health, I'm committed to raising awareness on the urgent need for sustainable innovation. I wish you a fruitful meeting and look forward to the outcomes, to learning how in the European Parliament we can help. Thank you very much and enjoy the event.
I must not tell you that over 100 million EU citizens suffer from chronic kidney disease and 300 million are at risk. And with the increasing number of European patients comes an increasing environmental burden too. That's what my colleague already said. Therefore, our focus today will be on green nephrology, a more sustainable approach to treating kidney disease. Now it's a time to undertake action to both protect the environment and ease the burden that chronic disease has on patients and their loved ones. We have the opportunity to achieve both. I really look forward to learning more about the sustainable solutions for treating kidney disease in Europe. Politicians, doctors and technicians will find a way so that the chronic kidney disease will receive a better treatment all over Europe. Thank you very much and a fruitful discussion.
I have to explain to you about the bidirectional link between kidney health and the environment, and that's certainly a neglected problem. Many people are not aware of it, and certainly many people are not aware of the extent, even among our professionals. But more than that, there is the problem of dehydration. Global warming and especially heat waves are causing dehydration. Dehydration is damaging the kidneys, is worsening chronic kidney disease, and is also a cause of kidney stones, and kidney stones in their turn also are affecting the kidneys. And there is also a direct link between air pollution and kidney disease. So it is clear that the areas of the highest prevalence of chronic kidney disease coincide with the most industrialized and the most urbanized areas. And then there is also the opposite. Also due to global warming, there are more and more severe floods. There are more and more hurricanes, tornadoes, and also heavy rainpour, as we have seen recently in the northern of Italy, and also in the west of Belgium, and in the east of Belgium and the west of Germany a few years ago during summer. And if those floods are affecting major cities, then they are damaging and incapacitating hemodialysis units. As we have seen there below on the slide, in Hurricane Katrina in the United States, where a large part of the city of New Orleans was flooded, and a large number of hemodialysis units were affected, and dialysis patients in an unprepared way had to get out of the city and go elsewhere in the United States for dialysis, which made them miss a number of dialysis sessions and was the cause of a number of complications. So the greenhouse gas production per year for all dialysis in Europe is the equivalent of 2.5 million car trips from Brussels to Istanbul, back and forth, of course, fossil cars. The healthcare area, which is already a great greenhouse gas production, well, we assume that dialysis takes about half of that, and that is the equivalent of the greenhouse gas production of transport or of shipping. So that's really very important. The water waste per year, that's the quantity of water that goes down into the drain because most of dialysis water is not reused. That's the equivalent for the whole of Europe and 1 year of 10,000 Olympic swimming pools. And the plastic waste production per year, and here I should go back, is 180 million kilogram, and that is approximately for the whole of Europe and 1 year the equivalent of the overall body weight of the population of the entire Brussels area multiplied by a factor of 2.5. So there is absolutely something necessary that should be done. And the question is what should occur. And the first thing is not directly related to environment. It is that there is a need of an increase of awareness. The chronic kidney disease still remains a heavily neglected disease among all chronic diseases, which are already much neglected compared to other infectious diseases, like, for instance, AIDS. So there is a need for more awareness, and that's a responsibility of all of us. That's not only something to be done by advocacy agencies. Every one of us must make the community aware of what it is that 1 in 7 people is affected by kidney disease, that it costs more than any other chronic disease to society, that there is a huge productivity loss, and that on top of that, it is affecting also the lives of patients and their families. Our children, which is our dearest good, children and grandchildren, and the picture I show is a child that was affected by kidney failure due to the earthquake in Syria, Turkey. Now, I have been notified by my colleague, nephrologist pediatricians, that we are running out of decent and appropriate CE labeled dialysis material for small children, which is two-faceted. First of all, a lack of CE label, and the rules have been made more severe recently. And on the other hand, the machinery is not appropriate for small children. It's machinery for adult people. And that needs to be solved, or otherwise children are going to die. And this has also an environmental facet, because if appropriate machinery would be developed, then it would be miniaturized, and automatically it would become more environment friendly. That there is a need for a change of paradigm in dialysis, first of all. And I think that's the most important, not the most important thing, but it is one thing. And one thing we have to do is to develop dialysis machines that consume less water, dialysis systems that are energy neutral, and a circular philosophy. And again, I want to stress that it is not only on the provider side, but also on the side of the manufacturer. But above that, we have to make that less people are in need of dialysis, and that needs more harmonized and more appropriate screening and prevention, more transplantation and regenerative medicine, stem cells, living cells, supplementing failing organs, or supplementing artificial organs. I thank you for your attention.
the cost of that home dialysis dependent on so much water and so much electricity, because our prices have gone up and up. If you are on, I think it's 6 nights a week, your additional cost was £1,000 a year over the last year. That's what it was going up to. And some people were not getting that money back. So therefore, they were having to make choices whether to go back to the hospital and not be able to use that option. Food prices are up. As we know, supplies are reduced, and people with, especially on dialysis, need the special diets, not the ultra-processed foods, but freshly cooked foods. And that is a difficulty in accessing the right nutrition as well that we've heard about. Petrol prices are up. Of course they're up. We know some of the reasons for that. And some people have to drive, as Ray said, to multiple medical appointments. This can become a barrier for people to get to their treatment. And overall, there is a risk of power cuts. I saw some public health information in France last year, and we had to do the same in the UK about the risk of what could a power cut mean to someone dependent on dialysis. And all of that followed last year's heat wave, and we've talked already about the dehydration and those risks, and a reduction in transplantation following COVID. And I would say that just for children, I was speaking with one of our nurses the other day, and I looked up the numbers. The numbers of children waiting for a transplant have doubled. So that means that there are far more children now depending, as well as adults, unfortunately, depending on dialysis, which of course is terrible for people's lives and for the families, but also has that impact on our systems and on our hospital healthcare systems as well, because all those additional costs will come to the hospital as well. So we heard from a lot of people with kidney disease, and we made a campaign named after one of the patients. A chap called Phoenix said, "I feel like I am being priced out of existence. I don't exist anymore." And he told his story, and we told many, many patient stories, and we all worked hard to increase awareness of this extra new vulnerability, extra advice, give more grants for hardship, and also people access to benefits which might be available to them. I'm sure everybody here will agree that a really good way to raise awareness of those issues is with the public, who might say, why do people on dialysis need extra money? Why is that important? So we went quite hard to explain all of that, and we had people talking about how cold they are on dialysis, people who didn't switch their heating on, people who are terrified, and people who were just pretty upset about the whole thing, and some of those really did grab the public attention. Basically, people worry all the time about the cost of living, and many of them did switch their heating off over the winter, and a lot of people missed their meals, at least missed one meal a day out of their diet because they couldn't afford the food. And the mental health impact of that was also very challenging, because it is hard, isn't it, if you don't know where your next meal is coming from, to deal with your healthcare challenges as well. And to move together, of course, the best thing is for greater awareness of chronic kidney disease and prevention of deterioration of kidneys, to maintain your kidney health, and to work, and of course, to create more opportunities for transplantation, because the first best thing is to prevent and delay. The second best thing, if possible, is to have a transplant.
No, thank you very much, Tasmin, and thank you everyone for the opportunity to have the patient experience, the patient feelings. I haven't prepared any slides because I would like to talk to you from my heart. How are we feeling? I could say that we are really concerned about greenhouse emission and natural resource deployed and waste generation, of course. But this is too abstract. We need to. I need to share with you how we are feeling every single dialysis session, producing plastic, producing a lot of water, electricity, and we are truly sorry. And this is not fair, you know, because this is vital treatment. We need to survive. So otherwise, we're going to die. So we are truly sorry because of this. So can you imagine how are the feelings, no, of the patients? Because we are producing a huge, a massive environmental footprint, and we need to change that. We realize that we cannot follow up with this model. This model is obsolete, and we are not blaming anyone. Of course, we need to establish this factory of dialysis sessions, because we need to save lives and we need to give the opportunity to follow up with the life. But at the end, we realize that it is impossible to follow up with this, and we need options. We need a better future, and of course, I think innovation is not only possible, it's imperative. So we are here to claim that, because we are truly sorry about that, and we need to change with a better future. Yeah.
To make it short, water management, we already heard how many swimming pools we can spare, is something where the industry is actively working, because there is the technology for reducing water waste. And there is also the technology for reusing water for lending, many uses. It has to be supported. Energy is also very important, and is where the European community should promote green energy, not just for dialysis, but in the hospitals. Our hospitals are often obsolete. They leak energy. This is a terrible waste. Every single dialysis session, 3 million patients, 3-4 million, because we do not have precise figures worldwide, 150 dialysis per year. And between 2 and 7 kilograms of waste, plastic, cardboard, everything. Some of it cannot be reused. It's against the law, it's contaminated with blood, okay. But the other, there is not enough research from the industry, and it's great that we have industries here today, on making this really reusable. It's just thrown away. And this is a terrible pity. We cannot afford it anymore. Our dialysis machines are done to live at least maximum 10 years, in some settings no more than 7, in high-income countries, and then they disappear. Poof! And some of them are given as a gift to our African poor friends, so that they will take care of dispose that all. It's a crime. There is the possibility of rethinking everything. Of course, it's costly. Of course, the rules of obsolescence that were initially made to help the patient should be reviewed. But there is the technology, and there should be the support of our society, of our politicians, to work in a better way. May I have the second slide, please? So, there is also the clinics. We all dream of a world without dialysis. So we can use wisely drugs, we can use diet to slow CKD progression, we can use physical activity to counterbalance malnutrition and to reduce the pill burden. We can use personalized dialysis to just give to everybody what that person needs, no more, no less. It's the bad footprint, black, and the nice hand, colorful, but it's not something that is done by itself. It's easier, it's faster to give a pill. In other way, it's the same throwaway society. We give a pill, we don't bother about it. Speaking to a patient, explaining, changing habits takes time. We are too few. We need to be supported if we want to shift from a drug consumist-based system to time and education.
Yes, thank you, Tasmin, and I would like also to thank you, Eka, for inviting me for the opportunity to represent the nurses, renal nurses, in this event in the Brussels European Parliament. You are right, the nurses play a crucial role in the front line of healthcare. And as EDTNA ERCA president, I can confirm that we as association, we have been working for many years to educate and support renal nurses, and to the rapid implementation of sustainable kidney care processes. And nurses, well, not renal nurses, but nurses are are present in every step of the clinical process, but also before the clinical process, because we can have a crucial, pivotal role in the prevention through education and awareness. So nurses can actively educate others, educate patients, educate people in the community, not only in the hospital, in the units, but also in the community, in the rural areas, about sustainable kidney practice, about prevention of kidney diseases. Then, of course, in the resource management, nurses can play a vital role in resource management. They can ensure, for example, efficient use of medical supplies, of medication, of equipment related to kidney care. And then what about, for example, the continuous quality improvement? Nurses are actively involved in quality improvement, and so by collecting and analyzing data, and we can promote, we can identify areas of improvement. And of course, nurses are involved in research and innovation. So I think that nurses can support this process in everywhere, absolutely everywhere.
How would green nephrology, give patients more power?
Yeah. No, I think it's a very interesting question, Tasmin, because as you know, as a patients, as a kidney patients, patient consumers, citizens, we are on the kidney community flagging this. No, I think the first thing is we realize of this and the awareness to start to talk about it. No? This is the first thing, to empower all the patients to be concerned about this and to try to change. No, and we need to hear more all the stakeholders, including patients, to change the reality. And I think our needs is to have a new treatment, new devices, maybe home therapies. We need to promote them now to avoid the use of water plants and water, and to promoting home therapies or new devices, new options. We will see that reducing this footprint, and I think for the future, all the stakeholders in a collaborative effort. We need to change, no? Scientific, of course, societies, healthcare professionals, pharmaceutical industry, and kidney patients together. And I think we can achieve it only with a collaborative effort, and to hearing more the needs, the real needs, and the reality. Because I am dialysis patient, as you know, and when I'm setting the machine and I'm recycling everything, paper and plastic and everything, I feel truly sorry, no? And we need to change that. And for the future, I think for the children, as Ray have mentioned, we need to deserve a better future for them. Yeah.
What are the barriers to actually trying out this more sustainable approach to kidney care?
Well, the barriers are in every moment of our work, for example, during a shift in the unit. And I can give an example of my hospital. I work in a very big hospital in the northeast part of Italy. And we started 2 years ago trying to do a campaign inside the unit not with patients, of course, but with healthcare professionals, just to avoid to use plastic bottles. Very simple, because everyone nurses, doctors, technicians, dietitians, the headers, with a plastic bottle, because of course we need to stay hydrated, okay? And we start to say, please stop plastic bottles. Please use your reusable bottle. And at the beginning it was, oh my God. But this is a small step. And of course, these small changes need time. And after 1 year in this unit, you don't see any plastic bottles. So we needed to start to very simple things, very simple habits, then starting from the healthcare professionals first, so also the healthcare professional can give example. So of course you can see my reusable bottles. I am the only one over there. And I'm very grateful that outside there is the machine and then you can refill your reusable bottle outside. So we needed to start from this.
Let me bring MEP Olekas in here, because one of the mindsets we really need to change is the fact that kidney disease is largely invisible at European policy level. It's not talked about very much. There's a lot of attention on cancer or cardiovascular, but kidney disease is just unknown. And if it's unknown, it's therefore not addressed. So how could you, as a member of the MEP Kidney Group, change that mindset, change that behaviour so kidney disease is more visible and therefore more known about?
Thank you very much. It's not easy. I fully agree with you what you said. Indeed, in the European Parliament and other institutions, we have some maybe not good tradition that we found only one way or one task to, for example, you mentioned the cardiovascular disease. Now we have the cancer beating plan. I feeling here that we not have enough holistic approach in healthcare sector. On one hand, it's related with the treaties, because it's not so much left for the European institution for the health as maybe, but we have here the possibilities to prevent, for the prevention. And in this field, the screening, the early detection of diseases, I think also can cut the number of use of dialysis and also to stimulate the new approach or maybe new action plan for more donation and transplantation, to shortening the period of dialysis. What we can do, I think we can organize the forum like this, be more active and inform the members of the parliament and also the other institution about the situation, because the kidney diseases, it's very, very big part of our life and the big part of the diseases, chronic diseases, and I think the new subcommittee of SANT and the committee should include the kidney diseases in the non-communicable diseases sector and work with this, not leave the outside of the attention. And this is maybe the next term of the European Parliament after the election will be the new start for more active, because for many of my colleagues here, it was new one. Health can be outside. It's the Commission announced the plan against the cancer, and then we not so much concentrate. But now it's the situation improving from my point of view, and we can achieve some results here.
If you want to reduce the pollution and the impact on the green environment of healthcare, you have to start with kidney care. So that's one way of prioritising. But thinking about the range of areas where Europe is very active on looking at how to meet the climate targets and the Zero Pollution Action Plan, the New Green Deal, how do we get healthcare as a problem that needs to be addressed more visible in that?
I think we should find the more our partners or our friends with whom we can discuss. You know, the ENVI committee, it was a huge discussion about the agriculture, about the restoring the nature, and they not reach the agreement between the environmental part and the agri part. And I think it's very important to show that not only agri sector but also the healthcare sector also quite polluted part of in this situation, and you're talking about very, very precisely about the dialysis and how much it's pollute for the environment and important for in that region, and we should raise this facts and get the support from groups of activists of environment issue, because I think it's really, I am by my medical specialty surgeon, and I know that for that reason that maybe the gold standard for treatment should be the transplantation, not long dialysis. And this is the way how we can explain for my colleagues here in the Parliament and other institutions, talking maybe more loudly about the situation and the need changes. And today we hear the good examples how we can influence the situation and try to act through the European Parliament, through the SAND committee, and we have the pharma strategy and other documents here in European Parliament, and everywhere we should put our attention and put our points in the situation.
How can we get these problems of the kidney patients and the problems of the pollution in that program? What's the best way to do that?
Thank you. I think that's a great question. I'm going to turn to MEP Olekas, because I think what you're asking us is how do we affect the Brussels machine? Because the Brussels machine works on certain frameworks. So we've got a 7-year financial envelope, the multi-annual financial framework, or MFF, and that's the one that you're speaking about. That's the overall amount of money and roughly what's going to be spent. And then individual programs often have a 3 to 5 year life. The big opportunity, of course, and I know we're going to talk about that perhaps later, is that this time next year will be the musical chairs. There will be a new European Parliament sitting, because the elections will take place in May. And if next elections is like the previous elections, at least a third of the MEPs who arrive are brand new, and they're just finding out where their office is and how it works and how does it vote. But the first thing they have to do is approve nominations from countries to be the next commissioners. And each commissioner and the incoming president will be setting out what their big political program will be. So then there will be a window of time over the next 12 months as political parties prepare their manifesto and as potential candidates for commissioners put forward their ideas to sort of raise issues. And I'll pass the floor to MEP Olekas about that. But I think that's what you're asking. How do you enter a machine that has its own rhythm and its own timing? So do you have guidance for us about the right timing?
Yeah, thank you. We have not so much instrument, but you mentioned that we have one. I think we need more discussions about the future of Europe. Last year we had the conference on future of Europe and discussed between the different European institutions, but we're looking forward and with societies, with citizens, and there are different opinions. The institution concentrate about some bureaucracy, the activity, regulation, but the people saying that health is very important one. And we should discuss about that with the candidates to European Parliament on the upcoming election. For example, in my country, I don't know how in you, but once we had the election for European Parliament not together with other national election, and only 20% of our citizens participate in this election. That means there's no interest, no trust, and then coming here and discussing what European institution can help for us. I think we need more trust to the European Union as a whole, and we should more actively act in this situation, because new Parliament, new Commission, as you mentioned, will have the program for next 5 years. You mentioned the 7-year perspective from annual financial perspective, and here we should concentrate. I said at the beginning, previously we more attention put on the cardiovascular disease. This time the cancer. But we need more holistic approach for the health, including the kidney disease. And only you can ask the future members of the parliament to say, what is your position? If you're supporting, not narrow position, but more holistic approach, and including the kidney disease, we will vote for you. And this is how we can organize, how we can influence directly in discussion with the candidates, also through the organization like you, like Forum of kidney diseases. I think it's very important for an institution because we need to lobby from the organized communities and to have the strong influence on the discussion here. Particularly after the election, this period from July 2024 till the December of 2024, it will be very important for the future 5-year period, how we will concentrate our attention. Thank you very much.
The amount of recyclable and potentially recyclable or not depends upon the type of dialysis, the use of a centralized machines or not. But roughly there is less than 30% that is, according to all laws, considered non-recyclable, potentially hazardous. Has been in touch with a relevant, not quantified, amount of blood or biological fluid. So a handkerchief, no, but bloodlines, yes. The rest of the material, only about 25% with the current machines is really potentially recyclable, because there are just stupid hurdles like being glued, being sewed together, having inks, having colors, having labels on the plastic bag, for example, that impair an easy way. Then not all nations have recycling facilities, but it's a vicious circle. Nothing is recyclable, no one cares. And the amount of waste that can be considered increases if we also look at packaging. Very often, there is a plastic packaging around the bloodlines, etc. And there has been from the industry a trend toward making things very nurse-friendly. You just open the cassette, tuck, tuck, and the machine is mounted. 3 minutes of difference, a big quantity of plastic that is wasted. So once more, it's changing the way we think.
Ilaria, do you want to comment on that, the potential trade-off that functioning or focusing in on the ergonomics of making it easy for nurses to do their everyday work, is obviously valuable because there's a limited number of nurses and a limited amount of time. But the trade-off there is lots more plastic. Where would nurses put that balance?
Well, you touched a very hot point, because on the other side, on one side, it's true that some packages are very nurse-friendly, because you just open and pick up and start. And so, of course, you save time and so on. On the other side, the situation now of nursing shortage, and I don't want to open this chapter, but just to mention that the situation now of nurses shortage is dramatic, not only in Italy, not only in Spain, everywhere in Europe, in the United States, and also in the low-income country, and it's difficult to find the balance for this. And I would like also to say that as association we are involved also in some event in the past and also this year in the European Parliament here, just to raise our voice among this problem. Because the shortage of nurses, I heard about this since 15 years, and many people talking event around the table, but then governments, so single governments, are doing nothing. And I would like also to underline, and also Fiona did, that in many European countries, the government don't invest money in public health, because this is the top. And if you don't invest money, you cannot make the nurses, for example, in better paid, good work conditions. And now, my experience is from Italy, now the shortage is not only nurses, but also doctors, for example, anesthesiologists and doctors in the emergency department. So now this is a problem that is growing, and sorry, my impression is that nobody is taking care of this.
Thank you for this question. I think in general the link between health and environment, as been mentioned earlier, is quite neglected. I mean, this is a room of well-educated people now on the topic, so some of it might be a repetition. But this link is often neglected. We're seeing now from our perspective as an NGO working on practical project on this topic that there are now more EU projects looking at how to improve the sustainability of the healthcare sector, which is good, but more can be done, especially when it comes to the policies. For instance, Green Deal, chemical sustainability strategy, textile. There are a lot of policies that focus a lot on consumer goods or other sectors. When it comes to healthcare, it's often forgotten or exempted or used as a excuse to delay things or is exempted. And there are some reasons for it. So when it comes, for instance, to plastic, of course, some single-use plastics is necessary. We've heard a lot of it, for instance, can be reused. And I think it's important to understand how to make the difference, what is necessary and what is just waste. And so that is something that we need to raise awareness about. And when it comes to raising awareness, we do this. We have a lot of good practices and case studies, not only from Health with Arham Europe, but other organizations, Sustainable Center for Healthcare, and so on. And there are best practices on conserving water, preventing or delaying dialysis with prevention. Also, we read about retrofitting heat exchangers for saving energy at home. We heard before about the price of energy, and so that is also a good one. Improving the patient's follow-up with telephone or like telemedicine to avoid, transportation, travel, and so on when it's possible, and improve waste disposal that we already mentioned. And when it comes to waste disposal, I must say that, again, this is a room of well-educated people, but we cannot recycle our way out of it. So up to now, only 10% of plastics in general, not in healthcare, has been recycled. Only 10% of all the plastic produced, or even less. It's about 9 it changes every year. And this percentage is even less in healthcare because of the issues we know, like infectious waste, although infectious waste is up to 15% according to WHO. And so we have to look more at solutions that do not say, okay, we will recycle it. We have to more look at solution upstream, because once it becomes waste, we have a problem. So I think that's a very important message to bring home, that we cannot recycle our way to it. Recycling is important. When it comes to circular economy, is not the first step of the strategy. So looking at where is necessary single use and when it's not necessary, that is important. We heard about industry innovation. More can be done for sure, especially product designers should talk to doctors and patients. Sometimes they come up with solutions that nobody asked for. Here we have clear demands, so let's focus on that. And then at the EU level, again, green public procurement. It is in the Green Deal agenda, it is in the Circular Economy Action Plan. There is a public procurement law that should be reviewed. It's keeping delayed. So making green public procurement mandatory in the healthcare sector is very important as a solution, because a lot of our hospitals are from the public sector.
Recently, France adopted an action plan on organ donation and transplantation. Can you tell us a little bit about this and how that came about?
We already had an organ transplantation plan in France. It was already the third one, which was a total failure. Actually, the objectives of organ transplantation were not reached. COVID had obviously a negative impact on that, so it worsened the situation, which was already bad. So Renalou decided to develop an advocacy strategy based on study. and on collecting data and on studying what was done in other countries, and especially in Spain and in the UK, especially in Spain, which was a good example because the results in terms of transplantation were much better than in France. So it did actually 3 professional studies, one about Spain, another one about UK, and also a medical economic study about the financial impact of dialysis versus transplantation. And based on this data, Renalou went to the Ministry of Health in France, to the Prime Minister, to the French president, to members of the parliament with concrete proposals about how to improve the situation and how to develop a workable and effective fourth plan, organ transplantation plan. And actually that's what happened, and it was quite successful. The plan was published in March 2022, and with objectives and money, which obviously is important. And that's the first time there was a dedicated funding, which makes a whole difference. There are also targets in terms of increase of dedicated healthcare professionals, dedicated resources, and objectives in terms of performance indicators of the different transplantation centers, and obviously targets in terms of transplantation. So we also used very much the media, with an op-ed article which was published in Le Monde together with sociologists, economists, and I believe that, and obviously nephrologists. So I believe that this partnership between patients and other professionals, and all that based on data, helped achieve actually something which we hope will concretize in improvement for transplantation for patients. And I know ECHA has been working a lot in order to develop and obtain a second action plan, and we were nearly there, and then COVID happened. And unfortunately, this plan was blocked while there were already concrete proposals about what could be done at EU level. So COVID is obviously not completely over, but we are now in a different phase, and we will have a new European Parliament, a new European Commission in a few months now. So I believe, and I really hope, it will be the opportunity to get this second organ donation and transplantation plan in order to make sure that we can have European proposals and European targets, because even if the fourth plan in France is good, obviously the margin for improvement is still big.
Let me turn to you, Dr. Foucault, because researchers and scientists, this isn't new. They've been working on this for a while, trying to find innovative and sustainable kidney replacement therapies. So can you tell us what's in the pipeline, what's coming, and is there a role for the EU in accelerating or getting these things out of the lab and potentially into the hands of clinicians and patients?
Well, thank you, Tamsin. Yes, I will try. I have prepared a few slides. Thank you. But before I start those slides, let me also come back to one of your remarks, Ariane. Now, this is a dialysis filter. It is a normal component. It is a significant part of the cost of treatment, and it is the heart. They also call this the artificial kidney. This is where the exchange of the toxins happen. Now, after each treatment in Europe, we throw it away. And you said, let's do something before it becomes garbage. I like that. Now, the good news is that, so this is not in the pipeline, it's already there. In the USA, they've got FDA-approved technologies, which FDA-approved, been with thousands of patients tested, and microbiology has been evaluated, that you can clean the dialysis filter up to 40 times You can reprocess the dialyzer up to 40 times and do this safely, but only for the same patient. Only for the same patient. So I use my toothbrush many times. I wouldn't like if you all would use my toothbrush and I get it back again. Huh? But for the same patient. That's already there. We don't use it in Europe because we've got some legislation that is just throw it away. But we've got a Green Deal now. We got a Green Deal. We want to not just throw it away. So if the Green Deal is demanding us to do one thing, there are tools to do it, but some regulations are, preventing us from to do that. While we know that our colleagues in the US have proven that it's safe, I think we should look into that and start using that. So that's not in the pipeline, it's already out of the pipeline, and it's available if we let us. Now, let's go to the slides, because that's the future. What we do now, ladies and gentlemen, with dialysis, whether it's peritoneal dialysis or hemodialysis, we use the dialysate only once, and we throw it away. It goes off to the drain. And the dialysate is, of course, it's not only the water, it's also the energy to heat all that water. And for every liter of dialysate that I make, I need 3 liters at least of good drinkable water. That's a lot of water we throw away. So at this moment, we have a very wasteful treatment as for water and energy. Now, the good news is that Made in Europe is a dialysate regeneration system for hemodialysis at least, which is near the market. So it's still in the pipeline, but it's nearing the end. So that looks like an interesting feature. But we're not only looking on that. So it makes also possible, by the way, to make your hemodialysis machine much smaller. It fits in hand luggage that goes along in the plane. So because you need much less fluid, you need much less heater capacity to heat it up, which means less energy, but also makes it smaller. So that is a very good one. But we're not going to stop there. Very interesting is, who'd like to have hemodialysis without needles? Who would like to have hemodialysis without needles? I would, if I would need it, and there may be a time I will. So, how can you do that? Because hemodialysis was, you take the blood out of the body and then you clean it. That's the paradigm. And now the paradigm might change, because this filter is big. I cannot really implant it easily. But with silicon chip technology, we can put the filter capacity, which is now here in this volume, we can put it in the volume of, say, a matchbox. Not the smallest matchbox, but a medium-sized matchbox. That is implantable size. But then that filter, if it's surgically implanted, has to last for 5 years. Whoa, that's even better. I just talked about something we could reuse this 40 times, which means 4 dialyzers per year. So 1 dialyzer would go for 3 months. And now 1 dialyzer would be implanted. I wouldn't need needles, I wouldn't need blood tubing. But it has to last for 5 years. Otherwise, you have too much surgery. Can it be done, ladies and gentlemen? Yes, it can be done. From the technology point of view, yes, it can be done. But we will need some things to change. We need funding. About 0.3% of what we spend now yearly on dialysis, as it is, if we take 0.3% of that for the coming 7 years, then by 2030, we will have this up and running in the patient. That sounds like a tiny percentage. It is a tiny percentage, but it's still a lot of money. It's about the amount of money you need to build 200 kilometers of 4-lane interstate highway. That is very possible. In Europe, I think we can build, if we want, we pull our wallet and we say, well, let's build those 200 kilometers of highway. We'll do it. So that is the amount of money about that we would need. And I'm convinced that we can do it, but then we also don't not only need the money, we need the best brains in the world to do it and make it happen. And those are not only in Europe, they are also in the US, they're also in Japan, they're everywhere around the world. But I know that technology, which is already in principle proven from the US and the European Union, together can make this happen. And you would have an implantable hemodialyzer. But hey, wait a minute, the dialysate, where does the dialysate come from? Well, that would be going through your belly, through your skin, with the peritoneal leads that we now know, those kind of catheters, and you would have a very small system that makes the dialysate and reuses it again. So the beauty is the dialysate regeneration technology that I just mentioned can be used for the next step as well. And that machine will not just be, it will be half the size of carry-on airplane luggage. So hemodialysis fits in a carry-on trolley for airplane, that's step one. Step two, half of a trolley in the airplane, just for the dialysate. The dialyzer stays inside. You don't throw away 156 of these per patient per year. You will need one per 5 years. It should be, of course, engineered, but ladies and gentlemen, it is possible to do so.
I work on the IHI in DG Research and Innovation. IHI is the world's largest public-private partnership in medical research. It brings together several industrial sectors, such as pharmaceuticals, diagnostics, medical devices, imaging, and biotech. Sectors that have all too long worked in isolation. So the idea is to bring the sectors and make them work together. And the aim of IHI is to deliver safe and effective health innovations covering the entire spectrum of care, from prevention to diagnosis and treatment. We've launched 3 calls for proposals, and we have a 4th one planned this coming July. So the question today that everyone wants to know is what can IHI do for green nephrology or vice versa? So this area, I have to admit, is very, very specific. But having said that, one of the strategic objectives of IHI is to recognize and address the green transition across all aspects of healthcare. So both in the delivery of healthcare to patients, but also in sustainable technologies and products. And IHI has its own strategic research and innovation agenda, and green objectives are embedded in there. Now, I wanted to point out that the next IHI call that is planned for July has 2 green topics. So the first 2 green topics. One topic will be dedicated, and we've heard a little bit about this today. One topic will be dedicated to sustainable circular development and manufacturing of healthcare products. So this could be, for example, developing new types of processing methods with increased efficiency, more balanced energy consumption, and less waste. The second topic is about promoting the development of new health products by integrating the principles of safe and sustainable design. So this is more about developing new technologies that generate minimal waste from packaging, and even enabling recycling of used devices. Then I wanted to mention also that the conception of co-creation does exist in IHI. We like to see it as a bottom-up stakeholder initiative. There is an opportunity to submit topic ideas. There is a process that is in place for that through the IHI website. There's a template to fill in, lots of questions. It takes time. I mean, I won't lie. You need to fill it out and explain why your topic idea meets the strategy of IHI, how it will deliver on the objectives. There are other criteria as well. One being why a large-scale collaboration such as IHI, which is a collaboration between different industry sectors and between public and private partners, why is that of added value? How could that really help? And I wanted to also mention that next February, as an aside note, next February 2024, the European Commission is organizing a high-level conference on research perspectives on the health impacts of climate change. There are dozens of sessions planned, one which will look specifically on climate change and greening of healthcare systems. So this is really high on the agenda today. Thank you. I think that's it. Thank you very much.
Thank you. Can you hear me? Yeah. It was just thank you to everyone for fantastic talks. I just wanted to ask Dr. Foucault just a little bit more about the miniaturization project, and I tell you why I tweeted about it. I will get that many questions about it because we talked already about CKD prevention. We talked about the elephant in the room, partly from transplant not being suitable for everybody, but for people who are already swimming, if you like, in the river with kidney failure, this is the kind of thing that can give them hope. So perhaps if you could expand really briefly, that would enable, I think, more people to understand what's going on there. Thank you so much. Hope for the future.
Well, I combine that with the elephant in the room. I like elephants, by the way. And I think they're very useful in rooms. So indeed, it might even be that children should be the primary first target to be saved and helped with an implant that can give them freedom to move. Because if it's one thing difficult for a child is sitting still on, we know that all from school, now you sit here and you be still. Children don't like that. Also, the amount of filtration that they need is, I'm a technician, not a medical doctor, but might be less than an adult. Although when they're growing quick, I see you nodding there. But they should not be forgotten. They are the ones where we can save the most QALYs, the most quality adjusted life years. So that makes them extremely important and fundable, yes. So that definitely should be part of such a program. I do agree, and we should bundle the best brains in the world to solve that and keep the elephant in mind. And I don't mind to be a mule on this one. Now, for your other one, the hope. I'm an engineer. If you ask an engineer, can you do a certain job? He asks you gives you three things. Should it be done good? Should it be done fast? Should it be done cheap? Choose two. Three is impossible. That means, and in medical, good is not questionable. Good is without discussion. Good needs to be. So that leaves you with only two. Do you want it fast or do you want it cheap? So far, we apparently wanted it cheap. That made that the innovation paradox has lasted for the last 50 years now. If you want it cheap, it will not be fast. It will even maybe stopped. So if you want these kinds of innovations, you'll have to provide the funding. And believe me, everybody always asks money. The funding is not even the biggest hurdle. The biggest hurdle is getting all the best brains in the world together, unify their goals, and make it done. And what we can say to the European Parliament and to the US Congress and to other governments, in principle, the experts across the world agree it can be done. The trouble is, if you want to have it fast, you will need to give them the budget to do so and the structure legally to do it together.
Thank you very much. I think we have had a very exciting afternoon. We heard a lot of things, a lot of interesting things, a lot of suggestions. I have to thank everybody who contributed to this very interesting afternoon. I think we're facing a huge problem, and we must be realistic about it. This is something that is affecting a lot of patients and also the entire society. So we need to find a solution, and we need to do it in a coalition involving everybody from patients up to industry to providers, but also policymakers, because they also have the possibility to make things move. And certainly one thing that struck me most this afternoon, we are probably all aware of it, but we do not realize it all of the time, that is this extreme vulnerability of the community of kidney patients that goes in whenever a crisis occurs, and climate change is a crisis, it is affecting our patients most. The example of children was very striking. In crisis, I think quite often what is a big problem is water, is electricity, and is money. And that's, if there are three things missing in any crisis, then it is water, electricity, and money. We have seen that in Ukraine. We see this with the example of the children, and we see it even more now in Sudan. That's off the record, but for the time being, it's really almost impossible to get dialysis material into Sudan. There is no support there are no donors, there are no involvement or not enough involvement from this community out of Europe. And I'm afraid that here again, a number of people, I'm not afraid, I'm sure a number of people are going to die just by lack of support and because people are not aware of what is happening. So we need to change everything. I think the most important, or not most important thing, an important thing that has been said is that the model is obsolete. That's absolutely true. The model is obsolete. We need to find something else. There is a need for innovation, and innovation, it's also innovation in our minds. We have been too conservative for too long. This has to change. It's not only about dialysis, but it is to a large extent about dialysis, but it's also innovation in prevention, innovation in screening, different methods, different minds. We need brains to help this happen, as also has been said. It goes also in the area of transplantation, stem cell. Probably the problem of rejection, it can be solved with stem cells if the thing is progressing enough. So our community is in need of innovation, and innovation is in need of investment. And with all stakeholders, we need to work on this, that we make it happen. We have to thank also everybody who is supporting ECHA, that is the members of industry, several of them are present here, and also our full members and our affiliated members. So the industry support is now displayed on the last slide. So we are very grateful for this, and it is also thanks to them that we could organize this exciting meeting today. And thank you for all your contributions and the discussion.